Urology Unplugged, where we dive deep into some common urological conditions. Today we are going to discuss two incredibly common urological conditions, that is BPH, benign prostatic hyperplasia, and kidney stones. Joining with us is Dr. B. Santhosh. He is the founder of Gem Kidney Hospital, a renowned urologist and a renal transplant surgeon with a wealth of experience in treating complex urological conditions. Thank you for joining the show, Dr. B. Santhosh.
Thank you very much for having me here. Thank you, Naushid, and your team. I will be very happy to be associated on this platform to share my insights on these two very common conditions.
Indeed, it is a pleasure to have you with us now. Let's start with BPH. Dr. Santhosh, can you explain what BPH is and why it occurs?
Yeah, BPH is a condition, benign prostatic hyperplasia. It is a non-cancerous condition. It occurs in elderly people of more than 50 years of age group. The prostate is a gland of roughly of the size of a chestnut, that is a walnut which we routinely have dry fruit. So it is situated just below the urinary bladder, and it starts enlarging after 50 years of age because of hormonal problems.
Who is most at developing risk for BPH?
Yeah, all the men above 50 years are at risk of developing prostate enlargement, and as the age increases, the risk also increases proportionately. If you take 50 years age group people, 50% or 60% of them will be having prostate enlargement. But if it goes to 80 years of age, 90% of the people will be having prostate enlargement. As the prostate enlarges in size, it compresses the urethra and it produces urinary problems.
What symptoms should men look out for if they suspect BPH?
This is because these symptoms are because of aging, but it is not like that. There are symptoms by which we can identify prostate enlargement because it has remedies, it has treatments, so people need not suffer about this. Coming to the symptoms, first thing is frequency. So a number of times a patient has to rush to washrooms, even during night times, that is nocturia we call it as, and even after passing so many times they feel that they have not emptied it completely, and while passing also they will not initiate the urination immediately, they will take some time to initiate urination. After initiation also the passing will not be easy, they will be straining to pass urine with poor stream, and the stream will break in between, that is we call it as intermittency. So frequency, urgency, nighttime urination, nocturia, intermittency, hesitancy, poor stream, all these are the symptoms of prostate enlargement one should look for.
How BPH is diagnosed?
Yeah, BPH diagnosis needs thorough history from the patient. In physical examination, we do a digital rectal examination to palpate the prostate gland, its pattern of enlargement and its nodularity to differentiate a benign enlargement from prostate cancer. And then we do some routine investigations like complete urine analysis, uroflowmetry. Serum PSA is a blood test we do to rule out prostate cancer, and some imaging studies like ultrasound, MRI or transrectal ultrasound we do for diagnosis of prostate.
What are the treatment options available for BPH?
So coming to treatment options, one is watchful waiting, that is doing nothing except lifestyle changes. So second is a medical treatment. Nowadays there are so many very good medications which can even avoid surgery for prostate glands. So second is a medical treatment. Third is a minimally invasive. Even if surgery is needed, it is not a major surgery. So by minimally invasive methods, we can treat this prostate gland. And finally, if nothing works, surgical treatment, a major surgical treatment we can do for prostate enlargement.
Are there any lifestyle changes that can help manage the BPH symptom better?
Yes, Definitely, there are a few lifestyle changes which can help patients manage their lifestyle very well. One of them is having adequate water, that is, staying hydrated is one. Then obesity is one of the risk factors, so doing daily physical exercise is the second thing. Third thing is avoiding caffeine or alcohol, which can irritate the bladder and increase symptoms. So with these few changes in lifestyle, we can get relief from these prostate gland related symptoms before going for treatment.
Now let's shift the gaze to kidney stones. What actually is kidney stones and why do they occur?
It's a very good question. Change over from a benign prostatic hypertrophy to kidney stones, another major problem in our society. Kidney stones are nothing but minerals and salt deposits in the kidneys. So once their concentration in the blood increases, they get supersaturated in the blood, and they are no more soluble and get precipitated in the kidneys. So they form over a period of time what we call as renal stones.
Kidney stone symptoms and treatment.
All of us know kidney stones. The first and foremost most important symptom is excruciating pain in the back on one side or both sides, depending on the location of the stones. So severe back pain which radiates from back to front and which is associated with urinary problems like burning sensation in the urine or blood in the urine, nausea, vomiting, or if it is infected, it can produce fever from low grade to high grade fever associated with chills and rigors. If it is not attended early, the both sided kidney stones can present with loss of kidney function or means renal failure.
Do all kidney stones require surgery?
No. So there are some stones which can pass off with pain management and medical expulsive therapy. So if stones are present in middle to lower ureter and the size of them is 5 to 7 mm, so the percentage of them passing out with medical treatment and hydration or pain management is more than 50%. So in such patients we can try medical treatment, hydration therapy and pain management. So rest of the stones, depending on the type of the stone, depending on the size and location of the stone, we can offer treatment, but all stones does not require intervention.
What can people do to reduce their risk of kidney stones?
To reduce the risk of kidney stones, first and foremost is to stay hydrated. So my suggestion for today is take 3 to 3.5 liters of water per day for a target of 2 to 2.5 liters urine per day. So that will make keep the urine clear and will prevent all the stone formations. That is first thing. Second is avoid if there is obesity. Metabolic syndrome also increases uric acid stone risk. So if obesity is there, then physical activity, daily physical exercise will decrease this risk of uric acid stone formation. Then if the stones are there in younger age group and if the stones are forming repeatedly, getting the stone checked for the type of the stone will also help to have a focused advice on diet or medical treatment for stones.
So are there any diet changes that they need to follow?
Yes, definitely. So I will tell 3 things which constitute 50% of the diet advice to all the stone formers. So first is take adequate water. Second is avoid animal protein. Third is salt intake, reduce salt intake. So avoiding salt, avoiding red meat and taking plenty of water is the 50% of the diet advice we give to any stone former. The rest of the advice is in vegetarians, we ask them to avoid cabbage, cauliflower, spinach, brinjal, tomato. And in fruits, we ask them to avoid sapota and black grapes. And we ask them to avoid sugary aerated beverages, which increase the stone formation risk.
So let's discuss about the myths related to BPH and kidney stones. First myth that people usually think is BPH, benign prostatic hyperplasia, is a part of aging and does not require treatment. Is that true?
It's a myth, but it has certain symptoms which people think that it is because of age only, but it has a reason: prostate enlargement. It has medical treatment, lifestyle changes, and treatment. So no need to suffer with those symptoms. Always you can visit a nearby urologist and get relief from those
So
symptoms.
definitely we need to go with the treatment if we
Yes,
develop the
yes,
symptoms.
yes.
Our second myth is that people think kidney stones form to only those people who drink too little water. Is that true?
It's true, but it's not, it's partly true. It's one of the risk factor. Dehydration is one of the most important risk factors, but there are other reasons like we spoke just now, metabolic reasons or any anatomical problems in the kidneys which produce urinary stasis in the kidney and form stones, and other risk factors as we just discussed.
Yes, definitely. Before we wrap up, Dr. Santhosh, what's your one key takeaway for our listeners?
So whether it is a stone or a prostate, if you have symptoms, don't ignore your symptoms. You consult urologist, you will get relief.
So now you got to know that there are definite symptoms of BPH and kidney stones, and you don't need to avoid it, and you have a proper treatment. So don't ignore the symptoms and visit to your urologist at the first go. Thank you, Dr. Santhosh, for joining with us. Indeed, it was a pleasure to have you on board. Thank you all the viewers. I hope you found the video helpful. If you found the video helpful, do share it with your friends. Don't forget to subscribe to Urology Unplugged and get to know about some common urological conditions. Thank you. Stay tuned.